Kaberamaido General Hospital is facing a number of challenges that have delayed proper service delivery to the populace. According to the medical superintendent, Dr. Eric Kauna, the facility has small old wards and theatre, inadequate power supply, understaffing and drug supply, as well as old equipment like the ultrasound but without X-ray machine. This was raised during the visit of the head of monitoring of government activities in Teso and Karamoja sub-regions, Lieutenant General Peter Elwelu, to the hospital.
What we have at the moment is, it was meant for health center 3. We have only one operating room, which means one patient at a time. So if you have like 2, gives you a challenge. So you either have to die or you have to wait for the other one to come out and tell you. We have our generator that we put on to handle emergency, but the generator is also old. We do not have the X-ray. The ultrasound scan that we have here is very old. The space, these buildings, they were meant for health center for.
Henry Damba, the Chief Administrator Officer, highlighted that the staffing level of the hospital stands at only 29% and the general health sector is at 33%.
In the health sector, overall, the biggest challenge now we have is staffing, because we have a staffing level of about 33%, and the hospital itself is around 29%.
Victor Res Ekesu, the LC5 chairperson, asked the government to allocate more resources for the completion of the new theatre and purchase of an X-ray and CT scan machine.
We want to beseech government to commit some modest resources towards the completion of that big theatre, which now is proportionate to the demand for services in Kaberamaido, and also help us to acquire X-ray and CT scan machine.
Despite the challenges faced by the local governments, Lieutenant Elwelu urged the government officials to utilize the resources that government has injected to the people well. According to him, the officers should serve people with one heart, free from corruption, so that they leave behind a good legacy as the government tries to solve challenges faced by local governments.
So for us now, here, this is the time for you to do something for your people. This is the time for us to do something for our people. Nobody should supervise you. I don't believe in supervision, because when you're seeing, if you're being supervised, then you must be there for. But I believe in doing the right thing, and without supervision.
Kaberamaido General Hospital started as a dispensary in 1928 before it was elevated to the current status in November 2018. It has a catchment population of over 2,000 people. Charity Marion Imnat and Imi Dilaksalomo for UBC.